Okay, sorry for the short disruption, but here we are. Anyways, as I was saying, if you have any specific issues that you want to talk about, I am happy to hop on a telehealth virtual call and we can discuss that together so that you get your best results. All right, let's dive right in. Just want to make sure this is still working. There we go. Okay, so we're going to start with the top 5 causes of hip pain that I usually see in the office. And anytime you experience hip pain, if it's an immediate pain, you want to go home and ice it for the first 24 to 48 hours for 20 minutes on, 20 minutes off, just to calm down the inflammation. And then after the first 48 hours, you'll want to do heat, 20 minutes on, 20 minutes off. And then if it keeps on continuing to be a problem, that is when you need to seek more care. So let's dive into the first thing. I guess we'll go from like least common to most common. So the least common, kind of most common thing I see is osteoarthritis. You really do need to look at x-rays in order to tell if you have arthritis in your joint. What osteoarthritis is when the cartilage between one bone and another bone has worn thin and it's not there anymore, or it's super thin, so now you get bone on bone action, and that's very, very painful. So when you have osteoarthritis, there's not always one telltale sign to tell you that you have it. That's why having an x-ray is really important so that we can take an actual look at what's happening inside. You might get a catching, it might be achy, might be dull, might be really sharp. It could get better with rest, and it can kind of just like come and go depending on what activities you're doing. So it can also radiate pain down into your groin area and even into your thigh. And you probably have some stiffness in the range of motion, and you may be walking with a little bit of a limp. So the treatment for the osteoarthritis is to 1, rest, 2, anti-inflammatory medication to help get some of that inflammation out of the joint space. Also, a clean diet will do you wonders. And you can also do some physical therapy and chiropractic. It's a little bit beyond our scope when it is bone on bone, but when bones are in alignment and muscles are working together, it can ease some of the pain. There's also stem cell therapy, so that is a little controversial, I know, and there's not a lot of research saying yes or no either way, but I have personally had patients who have had stem cells done and they are feeling like $1 million. And then the last but not least resort is a hip replacement, and they're honestly not that bad. You're up and walking that same day. The recovery is pretty speedy as long as you keep up with your rehab. So let's just hope that you don't have arthritis, and usually that is seen in older adults or people who have weight problems. Okay, so next we have iliopsoas bursitis. That's a fancy word for saying that there's a little fluid-filled sac that is like a little cushiony pillow in between your muscles, the tendons, and the bones and the joints. So there's a little sac in between, and when the muscles and the bones start to rub across each other too often, then that little bursa sac will get really inflamed. So then when you're doing movements such as cycling, running, biking, anything where there's like a lot of hip hinging, that little bursa in that area will get really irritated. So that'll mostly be in the front of your hip and that groin area. It'll probably be a little bit sharp, and then it will start to be dull. And what the treatment is for bursitis, you can rest it. That always helps with inflammation. Again, anti-inflammatory medication, chiropractic and physical therapy, because it could also be another alignment issue, and it might be due to some weak muscles or some compensation. And then also you can do just modify what activities you're doing, because if you're not someone who rests, just try to do something where you're not hinging so much at the hips and going in a flexing position. Okay, so then we have snapping hip syndrome. This is another common thing that I see in the office. So a lot of times people will feel kind of like this like snapping sensation or kind of like a pop. it feels like a guitar string is going across your hip bone, usually in the front of the hip. And it can range from the front of the hip to the side of the hip. So usually when it's in the front, it's honestly just your tendon sliding across the hip joint. It's really not that big of a deal. It's more annoying than anything. It can get to be a little bit painful when you start to feel the snapping on the outer portion of the hip, because that means the IT band could be involved. When the IT band gets really tight and starts doing the snapping, that can also lead to knee pain, ankle pain. It's just like not good. Also, you have to be careful that the snapping is not a labral tear. So you can differentiate that through an MRI. A labral tear will be when you have a little piece of cartilage that just like flaps off into the joint, and then it snaps every time you move your leg around. Also, when you have snapping hip syndrome, so you get the snapping sensation, you'll probably have some tightness in the front of the hip and maybe even into the side. It could be a little swollen. You might also feel a little bit unsteady or weakness in your hip and difficulty moving through all of the ranges of motion. So what do you do for snapping hip syndrome? Chiropractic and physical therapy are awesome because a lot of times we can figure out exactly why this is happening and work on the weak muscles, work on the compensating muscles, stretch what needs to be stretched, strengthen up the proper muscles, and then also put everything back into alignment so that you don't have that snapping sensation. Also, some good therapies to go along with that would be dry needling or cupping. Also, anti-inflammatory medication again, resting, and if it was really bad and it was causing a lot of pain, you would have surgery, but that's pretty rare. Okay, next, we're getting closer to the mobility one. We have a hip flexor strain. So those hip flexors are when you feel like you have really tight hips in the front. That's where you would more than likely have a strain. It can also involve some of the other hip flexor muscles, such as the quads, the adductors, like on the inner thighs. And usually this would just happen from overuse, just overstretching it, or you could get a direct trauma to the muscle. And what you'll feel is a mild to severe pulling in that groin area. It'll be like pretty uncomfortable. You'll definitely notice it. You can get some cramping, a really sharp pain, bruising, swelling, difficulty walking, and it will start to spasm a little bit if you have a complete tear in your muscle. I tore my hamstring one time and it was spasming like crazy, so it's not pleasant. So what do you do for a muscle strain? Not just in the hip, but any muscle strain. You want to protect it, first of all, and then you want to rest it, and then you ice it, and then you can put some compression on it, and then elevation. So the acronym is PRICE. Also anti-inflammatory medication, some like light cupping, like really light massage would be okay. And then also chiropractic and physical therapy, because we can pretty much do like a rehab protocol for any muscle strain that you have. And then you definitely want to make sure that you let it heal 110% before you go back to any activities, because you will definitely regret it if you go back way too early, because it's just going to be, and also you might re-injure it easier. Okay. So let's get to what we're really talking about today, which is muscle tightness and lack of mobility and flexibility. So we're focusing on our hip area. So this is where your leg would come out right through here. These are your hip bones. And then we have your booty bones back here. This is your pelvis. So generally this is the hip area that we're talking about. And muscle tightness is just so common. I see it pretty much in every single patient that I treat. And the reason why I think it's so common to have hip tightness is because we do sit a lot during the day. We're not activating our hip muscles. We're not activating our booty muscles. Our lower back starts to compensate. Like everything just starts to get weak, and then our body starts to compensate in other areas, causing some tightness. So that's why it's really important to really work on hip mobility, because it's really where we move from. We bend, we twist, we lift, like everything that we do has to start with the hips. That's like our axis point. So that's why when we have tight hips, it's probably more difficult to do Pilates or yoga or running or any of your favorite activities. So with a muscle tightness, it feels tender to the touch, mild to severe hip pain, limited range of motion. This can also end up causing lower back pain. It can also cause knee pain or ankle pain. And the best treatments for this are definitely, so you can start off with heat to help loosen up the muscles, 20 minutes on, 20 minutes off. Massage therapy is really good as well to get some of the knots out and get some blood flow going in. Daily, well, we'll skip that one. We'll do chiropractic and physical therapy, of course, because alignment is very key in making sure that your joints are moving the possible way that they can. And then also daily mobility and flexibility exercises, which is why we are here right now. So let me just do something really quick. Okay, make sure no one's calling me during this time. So what we're going to do now is a self-assessment. And since I can't see you right now, I'll just trust that you're doing it yourself. And the whole point of this is to really find out where your restrictions are in your body, where you're lacking mobility, maybe where you're hypermobile. And again, it's really important because all of our movement comes out of our hips. So when we go through these exercises, make a note of which ones are the most restrictive, and then you'll want to pick the top 2 or 3 and then add those to your daily exercise routine. You can do them in the morning and at night, so you definitely want to make sure it becomes a habit. Also, you'll spend about 10 minutes doing this every day, so not very long at all. And then once you progress through the most restricted exercises, then you can like move on to the next 2 or 3. And I don't really have a timeline of how long it will take you to feel like you're more mobile or flexible, because everyone responds differently. As long as you're consistent with it, it could take like a couple months, it could take a few weeks. It honestly depends, and it also depends on other activities that you're doing throughout the day. So basically, just be consistent and you will definitely notice a difference. Okay, we'll go through the guidelines a little bit more at the end and how long to hold everything, but let's just dive right into our first exercise. And you'll notice when we're going through these that it's not all just hip focused like you might think, but it's all the muscles that go into the hip joint and support the hip area. Okay, so number 1, we will start with a kneeling hamstring stretch. So you can do it standing, you can do it kneeling. I'll do it kneeling for you. Okay, so I'm going to work on my left side. Going into just a basic lunge on the ground, and I want to have my knee over my ankle to start with. And what we're going to do, if you need a little bit extra support, you can have a foam roller or support yourself on a table. We're going to straighten this leg out as much as you possibly can. And I tore this hamstring, so I'm a little bit more gentle with it. I like to have a little bit more of a bend in my knee. The foot will just hang out. You don't have to worry about flexing it or pointing it. It'll just do whatever it wants to do. And then you want to start to hinge forward at the hips. So your hip bones, you want to think about just bringing those over your extended leg. And I can go this far and get a pretty decent stretch. I don't really have to go much farther than this. You also want to make sure that your back is nice and straight. You don't want to round over, because then that goes more into a lower back stretch. So leg out, hip bones are really leading the way. So you're going to hinge at the hips and then wait until you get a good stretch. And you'll actually want to hold this for 2 minutes. So I know it seems like a long time, but it's much needed. All right, so we're kind of like flying through these because we're not doing them together, but that's fine. So hamstrings, again, we'll want to do an active hamstring stretch. And the reason why I included hamstrings is because when this back area of your leg, your hamstrings, get really tight, it can start to pull your pelvis forward, and then that can cause some hip strain in the front, also some lower back pain. So that's why we want to have some nice loose hamstrings to work nicely with the rest of our body. So for our active hamstring stretch, you'll lay down on the floor, and let's do our left leg. So right leg is just down on the floor. I'm going to bring my left leg up, hands behind the thigh. I have my toes pointed towards my face, and we're going to bend it at a 90-degree angle and then extend. So you bend and extend, and I understand that not everyone can straighten out their leg like so, so just do the best that you can. So when you go through 10 of the bend to straighten, then you'll want to point your toe and flex the toe. You'll point and you'll flex, you'll point and you'll flex, and you'll do that 10 times, and that's getting a lot more nerve activation happening, and also stretching all the way down to the calf. All right, so that's our hamstring. And I have all these guidelines on the ebook, so you can always go back and review this later. All right, let's get into everyone's favorite, the hip flexor stretch. We get our hip flexor stretch when we stretch out at the end or doing a restorative class, Eve's lunge. So I'm gonna stretch my left hip flexor, which means I'll bring my right leg forward. And I'm just going to use my foam roller for balance. Again, when we're in this position, you don't want to arch your back. That's putting a lot of pressure on the back. It's not fun, that's causing more pain. So we want to have a nice tight core. And how we're going to get deeper into our hip flexor is to maintain our core, keep our pelvis tucked, almost scooped under like a bowl, and then we'll just lean into this front leg. I have my foot flat on the floor behind me, and I haven't done like any movement yet today, so I'm not getting very deep in these exercises because I haven't really done any other physical activity today. But you'll notice that when you go through these, you'll end up getting a deeper and deeper hold, and you will hold this for 2 minutes on each side. And a question that I often get is it okay for my knee to go over my ankle? In this instance, yes, because we're focusing more on stretching out this hip flexor. You just want to make sure that you're maintaining core activation. All right, next we have quad stretch. So the quads are also often involved when we have a hip flexor strain because our quads help with this motion. Hip quad stretch, you can do it kneeling, you can do it standing. Let's just review it. So we'll go into this position a little bit later, so I'll preview it for you now. You're in a pigeon position, and then you can actually kick your back leg up and grab the top of your foot, and grab your toes. You can get a strap if you can't reach it, and then bring your foot as close to your body as possible and hold that for 2 minutes. If this is a little bit difficult, we can always go into the standing quad stretch like so. Again, make sure the core is activated. We don't want to be slouching, we want to be nice and strong. And then you want to also make sure that you're keeping your knees together, not winging out like so. So you would hold that for 2 minutes. And then when you're at the last 5 seconds of the 2 minutes, what you can do is just push it a little bit farther for 5 more seconds, and then relax. That should feel good. Are your legs getting loosened up? Because mine are. All right. I feel like we often forget that our legs move in all of these ranges of motion. So they kick back, they go forward, they go to the side, they go to the middle, they go around in circles. And we usually forget to work the back part of our body. So we're going to do some hip extension on the ground. All right. So you'll come into like a tabletop and then drop down to your elbows. And there's actually a bit of a breathing exercise involved in this, just to help get more blood flow into the hip area and also loosen up the low back a little bit more. So a cobra pose is basically what it is. And we will start by facing forward. You bring your forehead down to the floor. Okay, and then you're going to inhale on the way up. And then I just like to hang out here for a little bit, 10, 20, 30 seconds. And then you'll exhale when you're going back down. To make it a little bit more active, you'll just inhale on the way up for a 4 count, hold it for 4, and then exhale on the way back down. Next, let's get into the actual hip extension. So we're going to point our toes down towards the floor. We're going to work our left leg. So the first option is to lock out your knee, keep your hip bones into the floor. You do not want to lift them off the floor. And then we're just going to elevate our leg as high as we possibly can. You can see the range of motion is not that much. It could differ. Maybe you're a little bit more flexible than me. Option number 2, if this one is too difficult, is to bend the knee at 90 degrees. Make sure that you're still maintaining hips into the floor, foot is flexed, and then you just want to pretend to stomp the ceiling with your foot. And again, it's not a big range of motion, but you'll feel your booty firing up. Oh yeah, that's a good little workout right there. So it's just really important that we work the back side of our body, because that often gets turned off from how much sitting we do every day. Okay. Next, just have a few more, and then we're almost done. This is probably my favorite. So the butterfly pose, also known as the hip adductor pose, because we're stretching these muscles right here. And don't worry so much about getting your toes and getting the soles of your feet to touch. That's not really the important part. You can actually take a little bit of a wider stance. So whatever is comfortable for you. We are going to use our hands or our elbows to push our knees down to the floor as much as possible. Also, when we're in this position, you want to make sure that your back is straight. We're not rounding over at all. We want to take that out. We're just focusing on opening up the inner thighs. So you'll just hang out here for 2 minutes. And if keeping your back straight is a problem, you can lean up against a wall or just shorten the amount of time. And then at the end of this, give yourself a little extra push. Push down for 5 seconds, and then relax. So then from this position, we can go into a 90-90. So you'll start with your legs about hip distance apart, and then you're going to slide over to one side. It's called a 90-90 because you have 90, 90. And then you're going to hold this for 2 minutes on each side. So we're getting a really deep stretch in our adductors and inner groin area. This is also working core because I don't want you to rely so much on holding onto the floor or leaning one way or another. Ideally, you'll be up straight as much as possible. You can hold onto a block or a foam roller to keep yourself upright. And then when you do 2 minutes on that side, you'll roll over and do 2 minutes on the other side. This can also be a little stressful on the knees. So again, a yoga block or a pillow to bring the knee up off the floor if that feels a little bit better. Have a foam roller to lean on if you are not able to stand up straight. So like use what you have around the house in order to make this work for you. Okay. Next are two really fun ones. I don't know, I just think they're fun because they're different. So what we're going to do, you're going to want to find a chair or a table, something that's about like hip height, depending on your flexibility. A little bit higher if you have really good mobility and flexibility, a little bit lower if you don't. Excuse me. We're going to work on external rotation. So external rotation is this motion right here. And what we're going to do is, let's work our right leg. So I'm bringing my right leg up, almost in like a figure 4 position, or like a pigeon position. And then I'm going to rest it on my table, chair, whatever I have. So this is a little bit too low for me, but I'll make it work. When we're in just this starting position, you want to make sure that your side booty on your standing leg is activated because we're working the hip on this side with muscle activation, and this side we're working mobility. See how it all works together? So what we're going to do, you're going to have your toes or ankles flexed, toes flexed, and then I'm going to push into the table for 5 seconds, table or chair, and then we lift it for 5 seconds. And it's not like that big of a range of motion. And it's important to have a tall enough surface because I don't want you like leaning forward too much. So I push it in and lift it back up and then hold. Sometimes my legs start to cramp when I do that, so just rest it if that happens. And then of course you'll want to do the other side. So one side is usually better than the other. My other side is a little bit more open, so I'm pressing in and lifting up. And it's all coming from the hip joint. This leg is nice and activated, side booty's activated. I'm just lifting from the hip joint. There we go. And your leg might be bent like this, like so. Just make it work. All right, so next, since we're doing muscle activation, now we're going to do flexion. So this position, and we're going to use the same surface, maybe something a little bit taller if you have it. So I'm going to do my right leg. Left booty, left leg is really stable, and I'm going to lean into my bent knee, still keeping this active the whole time, and then I'm pressing into this block, just like I was doing with the last exercise, and then I'm going to lift it. So it's a 5-second lift and a 5-second push. And again, you can let your knee go over your ankle. Just make sure it's staying more in alignment rather than in or out. This is nice and active. And then lift for 5 seconds. And a lot of times what happens is that the hip flexor right here is actually weak. So I know that sounds so silly because it's so tight and sore all the time. So this will really help to get more of that hip flexor activation, also strengthening. And a little bit more advanced thing that I do with patients is taking an exercise band and resisting that motion with an exercise band. You might feel a little bit of a pinching sensation because those muscles are not used to working like that, and there could be some inflammation in there. All right, so now that we made it through, I don't even know how many exercises that was. I should have counted, but those are the top exercises that I prescribe to anyone who has hip pain. And then we'll go through 2 hip mobility routines so that you can easily add this to your repertoire of exercises. And it's very easy to do anytime, anywhere. There's 5 moves, and it's basically just a flow of most of the things that we did. So let's get started with that. You're going to start with your standing position and pick a leg, any leg. Let's see. We'll go out to the side. So now I'm in a wide stance, and then toes are pointing forward, and we're going to do a lateral lunge. I'm going to lunge into my left hip, keeping the knee over the ankle, booty is back. We're getting a nice deep stretch into this inner thigh. Also getting some booty work. So you're gonna hold that for about 5 seconds. And then we're going to rotate. And let's see, we can do, so we're gonna rotate, that knee is down. Swing the other leg forward. Now we're going to get into our hip flexor by leaning forward. So we do that for 5 seconds. And then we're going to drop into a pigeon position. So now we're stretching that outer booty area, and then you lean forward. And then from here, we can do that quad stretch, where we reach back and grab our leg. That's really deep stretch. And then after the quad, we'll get back up again into our kneeling position and then go into the hamstring. And again, keeping the back straight. And then you'll get back up. Look, you're in the wide-legged stance again. And then you go over to the other side. Get a stretch over here. Then we'll kneel. Now we're going to stretch this this hip flexor. And then we go into a pigeon. You can stay up if that's comfortable, or you can lean down. And then you get into the quad stretch. Use a strap if you can't reach your foot. And then it goes into the hamstring. So, just like that. And then you're back to the beginning. So you'll want to do that 3 to 5 times on each side. And just notice what feels good, what doesn't feel good. You can stay a little bit longer in the ones that need a little bit more work. And my all-time favorite, I don't know why it's my all-time favorite, but it's just so simple. But my all-time favorite hip and ankle mobility exercise is a very simple deep squat. So we're going to have a wider stance, toes are pointing out. We're just going to drop down into a very deep squat as much as possible. So I'm pretty flexible, so this is easy for me. Keep your hands in a prayer position and elbows into the knees, or you can put your hands down on the ground, hands out, whatever feels good. And we're going to push our knees open with our elbows while we're pushing our thighs into our elbows. So elbows into thighs, thighs into elbows, and we're getting a nice isometric contraction, and then relax. And I also love this so much because we're getting a lot into ankle flexion and mobility. So fun fact, if you have really stiff ankles or you've sprained your ankles quite a bit, they're probably lacking mobility, and that chain then goes up into the knee not being very stable, and then that can go into a lack of hip mobility. So that is my favorite exercise. You're gonna do nothing else from today, just do the deep squat. So. Okay, so just to recap, what I want you to do with this is identify your limitations that you have, keep a note and track which ones are the most limited. Contact me. You can call me or text me 720-509-9379, or you can send an email to info@elitechiropracticdenver.com. And I would just like to do a virtual assessment with you so that you can make sure that you are doing the moves correctly, and also give you a couple more tips and tricks to remain pain-free. And if you have any other questions, I can answer them at that time. All right, so I think that's all I have for you today. I will also leave the link to the ebook in the comments so that you can have access to it at any time. Thank you so much, and I hope you enjoyed this. And I will see you soon, and stay safe, stay healthy, and stay happy. Bye.